We are very pleased to organize this webinar together with CARE USA. This webinar is part of a series of activities IRC has carried out for the SWASH Plus project to promote results and to share the findings with a broader audience. We have 2 presentations today. Each will take about 15 minutes. The first presentation is based on the SWASH Plus research in Kenya, to be presented by Keene and Jason Oyugi. The second presentation is based on the work by UNICEF India on involving supporting governments to implement WASH in schools programming. This will be presented by Mamita Thakkar of the Water, Environment and Sanitation section of UNICEF India. So who are you? We realize it's a bit difficult for participants as they cannot raise their voice, but it would be nice if you could perhaps introduce yourself very briefly by sending your name and country you're in, so other participants can see a bit who is involved in this webinar. And you can use the question chat at the right-hand side of your screen. In this webinar you cannot raise your hand, but you can ask questions, and we really do encourage you to ask questions on the presentations, and you can also do so by using the chat, the question chat box. We will collect the questions and ask the presenters to answer these once the presentation is finished. If there's not enough time left, the presenters will make sure that all your answers are included in the reporting of this webinar, and that reporting will be shared with all of you. If you have a technical problem, you can also use the question box to send a question to the organizer. And to Harry. His face is here so you can see to whom you're addressing your problem. The webinar will be available on the WASH in Schools website. And the report and the article we will prepare based on this webinar and the question and answers will also be made publicly available. And you will all be given, all be sent an email with all the links to the materials. So now, I think without any further ado, I would like to give the floor to the first presenter, Jason Oyugi.
Hello everyone. My name is Jason Oyugi. I'm from Nairobi in Kenya, and we are going to give a joint presentation with Keene, my colleague in Atlanta, USA, from the lessons on the school WASH project in Kenya. We will take about 15 minutes. I will try to go a little bit quickly. I hope you can see my presentation. Comprehensive school health in Kenya, moving beyond infrastructure. And basically what I will do is to give the background of this project, and then Brooks will do the last bit, which will include some of the policy work that we have been, advocacy pieces that have come out of the project. And you can also get more materials after that. So the background and the context in terms of, this is the Kenyan country situation. We have about 40 million, the population is about 40 million. The number of school-age population is just about a quarter of that. And those children going to school is it's slightly less than a quarter, 8.6 million, with about 2 million children out of school. Basically that paints the context within which the school-based programming is done, basically in all respects, not just in school WASH, but basically in the entire population that is targeted with this kind of project. For schools, primary schools in Kenya is about 20,000. So that is the target that this project actually aims at in the final impact level. In terms of the policy context, the work in school WASH is guided by the main policy frameworks in the country, which is the overarching policy framework is Vision 2030, which is the Kenya's long-term development plan. It has 3 pillars, socioeconomic and political. And the work we do in School Wash cuts across the social pillar, but 3 sectors in the social pillar: the education, in health, and water. So basically where we are coming from with infrastructure is that we have a lot, like many other countries in Africa and elsewhere, we have poor primary school infrastructure, which is one of the biggest barriers to quality and access in education. And that has been quite a key driver in terms of what has guided the work in school health and School Wash in particular. On that screen, I have put there some of the dichotomies that inform this, have informed the project. On the left-hand side, you can see the old challenges, which are basically the hardware challenges, backlog in infrastructure provision, and then infrastructure that exists is in poor condition, and then the free primary education has also added pressure on the existing infrastructure, and then certain areas like ASOL there is arid and semi-arid lands. Those are semi-desert type ecologies, and urban slums are worst hit because there are not enough reach in terms of infrastructure. But I think the major part of our project is based on the right-hand side of that slide, which are the new challenges, basically the software challenges around infrastructure. The biggest one is maintaining the infrastructure and the quality learning environment, then deepening the knowledge on approaches that work in order to scale up good quality infrastructure, policy goals right from the national to the school level, and then capacity, recurrent cost, which is one of the things Brooks will be talking about, and the comprehensive school health needs. If you look at that slide, what I have summarized there are some of the basic challenges we have tried to respond to with the overall goal of ensuring equity and access to basic education. We have 4 main ones I have listed there. The first one is infrastructure facility expansion, but then the sections we have invested in a lot in our research project has been in M&E, in governance, and recurrent costs. There are other elements that include, that contribute to infrastructure quality. So what we have done is to try to ensure that we go beyond the government's biggest challenge, which is providing physical infrastructure. And so that means that thinking about what exists, how can the existing infrastructure be made to work better to improve the quality of learning and health for primary schools children. I have also highlighted there, you can see the policy framework where we are coming from in terms of the Kenyan policy context, drawn from our constitutional dispensation, which is a new constitution. The provision of water, sanitation, and hygiene is a constitutional right, which is enshrined in our constitution. We have a form of government that puts a lot of emphasis at the local government level on devolution. And the sector itself is coming from a background where we are discouraging standalone interventions in school health. So routinely, development partners have worked in WASH, nutrition, disease control, and so forth, standalone. So one of the things that we are trying to move around is how can we ensure that projects and interventions such as school health can have a more comprehensive approach and not just one way of looking at school health. Basically, the summary is that policy context is increasingly getting complex, it's unpredictable and untested. So that is the environment in which we are doing most of the work in the school health project. In the enabling environment, I think there is just a quick summary there about what we think are important prerequisites for sustaining school health interventions. Coordination, we have learned, is a key one. Sustainability at the school level, and that is what the governance is about. M&E information, resources mobilization, which all contribute to the school learning environment that we are trying to achieve. in the current setup, this is what I'm talking about. You have the black spot there is the school, and what we have, these are just examples. We have international agencies, development partners, government, World Bank, World Food Program, national NGOs, local NGOs, CBOs. They all rush to the school with different standalone projects, some on school wash, some on nutrition, some on disease control. The idea is the school managers then get overwhelmed. There are also duplication because there's poor coordination in those projects, and it's difficult to get a sustainable approach. Basically, because of poor documentation, it's not easy to know what's working and what's not working. So part of the intervention we have is to improve learning among most of the actors who are working in these projects in school health in general. We are also implementing against the context of a strong momentum from the education side and also from the public health side as well. Working also within the current and planned investments in school wash, which are guided by the Ministry of Education partners. And then we have also a very good, we have a lot of policies that are enabling, both from all sectors, from water sector, from public health sector, from the education sector. But there's a problem with capacity for implementation. So part of the interventions in school wash is trying to generate knowledge on how that can be accelerated. I have listed there some of the routine challenges that we have had that I've been talking about: poor coordination, wastage, poor reporting, increasing disease prevalence for other health-related conditions leading to poor school performance. And the idea there around, particularly that last bullet, is that when we have standalone interventions, it's difficult sometimes to know how a standalone, for example, providing hand wash facilities, if how that, when it is not sustainable and there is a behavior change that does not happen, and children, school children regress, then you end up causing more problems basically because of the infrastructure that is on and off infrastructure, because behavior change doesn't go on and off. So when you have an intervention that doesn't go the full cycle in terms of sustainability, then you actually, in the longer term, what you do is that you have more negative impacts on school health. That is one of the lessons that we have also learned. This is basically the cycle of the comprehensive school health at the school level. We have policy guidelines from the national level which are transmitted to the school management committee. And then the program covers 8 sectors: value and life skills, gender, child rights, water, sanitation, and hygiene, which is our entry window. There's nutrition, disease prevention, special needs, blah, blah, blah. The point around that list is that that is the full package of school health programs that the government of Kenya is trying to promote. So each and every development partner who has a window, whether you are a nutrition specialist, a gender programmer, you need to support the school to do a plan that will encompass all these aspects, such that when you draw out your work plan, somebody else who comes into the school will know what has happened in another subsector. So that is basically what the comprehensiveness is about. And then this is a normal project cycle from the action plan, implementation, M&E, and then a review. That is the structure of the, let me go take you back there. You can see policy guidelines to SMC, that arrow. This is actually the arrow we are talking about from the ministry up to school. You can see the last horizontal bottom line there, school management committee. So there's a chain of hierarchies from the national level to the school level. And then the school level, there's a health facility committee that helps to implement this. So I think basically I want to ask Brooks now to go further to that slide that I've just opened, if I'm not wrong. Brooks will take us through the specific policy project that we have done in terms of doing the advocacy and research. And so I want to hand over to Brooks to go on from that. Brooks?
Okay, hi everyone. Good morning. I'm just going to go rather quickly since we're running out of time, and I'm just going to talk a little bit about some of the advocacy that we've done behind the larger project that Jason's described. So our advocacy centered on three high-level objectives around increasing funding for the operations and maintenance, because we knew that that significant investments, although not sufficient, were being made in the capital and infrastructure improvements, and we wanted to make sure that those were sustainable. Second, monitoring and evaluation for accountability. So as you saw that sort of cycle of M&E and review that Jason showed, that system is actually working. And then three, around knowledge and improved behaviors. And we'll get into some specifics about what those meant. Okay, so one of the reasons that we ended up with this list of particular objectives is a result of the larger research. So the project included a cluster randomized trial design where we were actually going to measure the impacts on school performance and also on health. And aside from that, it also went over the course of 3 years. And so we did see some positive impacts on absenteeism, for example. But unfortunately, what we also saw as we went over the course of measuring these things for 3 years, and I've got one graph here that just shows one particular indicator where we were measuring one of the intermediate outcomes towards these impacts, which is whether or not the schools were treating their drinking water. And we had three different arms of the research. So we had some schools that were getting just water treatment and hand washing intervention, some that were getting that plus sanitation, which is in red, and some that were getting that plus sanitation plus water, which is the one in green. And you can see at baseline down here that the schools, basically none of them are treating their water. You get about a year into it, and quite a few of them are treating their water, and then we sort of peak, and then by the end of year 3, we're back down to, only between about 18 and 38% are actually treating their drinking water. So it's not a very high level of uptake by the end. And as we delved into what the reasons for that were, we started incorporating more questions around this issue of budget. So we asked each of the schools if they were budgeting for a bunch of these different elements that were really important for school wash. And quite a few of them were budgeting for things like water treatment and soap, but then when you asked them whether or not their budgets were sufficient, almost none of them were. So that really validated that first goal. And just to say, that's just an example of how the research was feeding into these goals, but we went on to identify very specific goals within each of these. So on the funding side, we settled on an amount by doing a basic costing, which actually doesn't include all of the maintenance costs because we weren't able to get into all of them. But for the operations costs, we settled on about $3.30 per pupil per year. On improving monitoring and evaluation, we did some research on the government's current systems, and we found that they weren't very appreciated by the schools because they were seen as being more of a policing action. So we said they need to be downward, decentralized, and supportive. Knowledge and behavior change, we had been working on a curriculum with CDC for some number of years, and so we wanted to make sure that that was able to be used in the teachers' training colleges, that it could be officially used in the schools, and that, importantly, that it could be used in training already in service teachers to improve on and emphasize for them the importance of these behaviors. And then we're adding another one here, which is around better coordination. As Jason said, Kenya has a comprehensive school health policy, and we want to respect that and make sure that we are integrating WASH into the larger framework here and not being one of those actors who are sort of creating an additional challenge for the school level management. Okay, just to say a few words, one of the planning and monitoring tools for ourselves that we used is called outcome mapping. And it's a methodology that was developed by IDRC in Canada, and we found it enormously helpful. So if you look at the right-hand side of this over here, you will see, I don't know, let's see if there's a way I can, okay. If you look at the right-hand side of this over here, the health and educational outcomes are really what we're looking for, and these happen within pupils. So we want to see decreased absence. We want to see decreased diarrheal disease, etc. And the primary actors that are going to make that happen are school administrations and students. And so we have to be realistic and say, are we going to, SWASH Plus as a limited research and advocacy project, we're not going to interact with every school administration and student that will actually get us to these health and educational outcomes. And so what outcome mapping does very helpfully is it sort of asks you to define who your boundary partners are. Who are the actors who you can directly impact? And then you define the outcomes that you would like to see, expect to see, and would love to see in terms of these boundary partners. So you don't really worry, in some senses, you try and draw the causal chain, but you don't really worry about what these actors are doing. Whether or not we have success is defined in how we're able to influence these particular actors here. So in our case, it was the national level officials in education and health, then it was other NGOs and development partners. In a way, it inserts a bit of humility into the process, saying that unlike a logistical framework, we don't think that we can actually control the entire chain of causality. In terms of some of the results to date, so on the funding side, there was a doubling of operations funds for school WASH. So they give a per pupil amount to each school each year, and so the section under WASH was doubled. It is nowhere near meeting our goal, but we think that there's good potential to increase that in the future. We've just gotten another phase of the project funded, which will largely be around advocacy and governance work. So we think that there's actually quite a large potential for getting this increase because the government is actually reviewing the free primary education budgets, and it has a task force to do so. There were funds allocated for sanitary pads for schoolgirls last year for the first time. And this is due to SWASH Plus, but definitely not just to SWASH Plus. This has high level of political interest as well from the Prime Minister's wife in particular, and resulted in quite a bit of press attention and everything else. So this is a win, but it's not ours alone. As we said, it's more about contribution rather than attribution here. There was an agreement to develop a school health sustainability charter, which has actually been drafted, and as in keeping with that integration goal, it's not just about school WASH, it's about all of those 8 areas, and we expect to launch that during the next phase nationally. There's an agreement on a need to improve M&E systems, and this is in some ways we know unfinished business, and so this is part of what we're going to be working on. We're going to be working on the EMIS with the Ministry of Education and the Ministry of Public Health and Sanitation to make sure that the whole cycle of monitoring is working, and that it's supportive to the school level. And then adoption of the WASH curriculum materials by the Kenyan Institute of Education. So everything has been fully adopted officially, a process that took some 4 or 5 years, I think, and many revisions and lots of work. And now it's eligible to be used for in-service training in the teachers' training colleges, then in the schools. So I'll stop there. I think we're out of time on the presentation side, so we can move on. Thanks.
Okay, thanks very much, Brooks and Jason, for a great presentation. And we've also seen some positive comments come in through the chat. So because of time, I think we may only have time for 1 or maybe 2 brief questions. If you could kindly be brief in your responses. The first one is, as far as increasing operations and maintenance costs and recurrent costs, could you explain this further?
Yes, so well, Jason, feel free to kick in if I miss something here, but the government of Kenya, supported by DFID, but I think mostly funded by the government of Kenya, had a infrastructure investment program that was part of a program called the Kenyan Education Sector Support Program. and it had a number of investment portfolios, one of which was around school infrastructure. And they were putting significant amounts of money into improved infrastructure, some of it for things like classrooms, some of it for improved latrines and water, things like rainwater harvesting systems. And our analysis was showing that both from our own implementation and then more anecdotally from just looking at the infrastructure from the government systems, that a lot of this infrastructure was falling apart relatively quickly. And it's no wonder, because the budget lines weren't there for that. So one thing we did, and just to add a little bit more on what I said, we had people who went and actually tried to cost out the cost of water guard to treat the water, the cost of repairing latrine doors, the cost of providing soap for a full year, the cost of providing menstrual pads for a full year, etc. So we actually tried to develop the specific costs, and that's where I got the $3.30 figure. And I'll say that that the government, I think it's fair to say, had not seen a figure like that before, and it gave them something quite concrete to latch on to. And so it immediately entered into the discussions on their budgeting for the per pupil grant that they give to schools each year.
Okay, thank you. Another question, will these sorts of changes survive a change in Kenya's administration?
Jason, you want to take a crack at that?
What, Malaika, what did you say?
The question is, will these sorts of changes survive a change in Kenya's administration?
Will they survive a change? Yes, they will. The good thing about the changes that have come across is that most of them, even though initially most of them were administrative, but they have been followed by policy guidelines that are able to be used and referred over time. At the same time, there is quite a good transition mechanism from the national government to the county government system in terms of allocating and sharing responsibilities. So we are optimistic that those policy guidelines will be useful reference points and will guide further implementation at the county level.
Okay, excellent. That's definitely very encouraging to hear.
Yeah.
I think we can take one more question.
Sure.
It says, in the outcome mapping, you note boundary partners, example, NGOs, national officers, and focusing on key champions within this group. How do you go about this in terms of finding and selecting these champions?
Basically, what we did was an analysis of the different stakeholders and seeing where the particular decision-making power lay, and you know, sometimes you find from those people, when you go to meet with them, you find a very receptive audience. They're very interested, and then sometimes you don't. So I think the thing to do is that what we did is we focused our energy on the people we thought were very interested in the project and were interested in the topic, and basically focused on them and cultivated them over time. And they have their own interests as well. So, you know, sometimes they are coming at it from a girls empowerment angle, for instance. So the DFID advisor, who was based in the Kenyan Ministry of Education, DFID had a particular interest in girls empowerment and education. And so that was the angle from which we spoke, and we were able to do that because we had research results showing that girls in particular have decreased absenteeism from school WASH. So I think part of it is identifying the people who are positive about the work you're doing, and then also making sure that you're lining up with their interests as well.
Okay, thank you. Excellent. I think we're out of time, so thanks to those that sent questions, and thanks once again, Jason and Brooks, for that presentation. And now I will pass the floor to Mamita Thakkar for her presentation.
Mamita, can you unmute yourself?
Hello?
Yes,
Hello?
yes, we can hear you. We can hear you now. Go ahead.
Can you hear me, Harry?
Yes, we can all hear you.
Hello?
Mamita,
Yeah?
you are now as a presenter, so you can start your presentation.
Yes. Is my screen visible?
Yes.
Yeah. Good morning and good afternoon, everybody. It's actually late in the evening here, but some other parts of the world, I think it's morning and afternoon. Thanks, Jason and Brooks, for the wonderful presentation. You have taken the route of research and analysis as tools to influence policies and practices and programs. What I'm going to present is that approach to addressing policy issues, taking the through the bottleneck analysis that we have done in India and identified the key areas where we actually needed to work on policies. So what I will essentially be sharing is the bottleneck analysis approach that we have adopted, and I'll take you through for over the next 10 to 15 minutes on the approach that we have adopted. Next. Yeah. Let me begin with the sanitation status in India, just to give you a brief background of where we are, because the issue of sanitation is pretty grim as far as India is concerned, the large country, and even in 2011 we have 626 million people defecating in the open, about 1.7 million, that is 22% of the world's total under 5 children who died in 2010 were born in India. And you can see this is the map of 2000, 10 years ago, where many of the states in India had less than 25% of coverage with individual household toilets. The situation is a bit better in 2011. We have fewer states than what we had 10 years ago, but nonetheless it is still, we have about 8 to 10 states where the situation is fairly bad with less than 25% of coverage with individual household toilets, and we still have a long way to go. We will definitely not reach the MDG targets, and yes, I mean, we really need to work at it. Coming to the status of WASH in schools in India, some of the key facts that I wanted to share here is you can see that we have made considerable progress as far as the situation of drinking water is concerned. We almost have 93% of schools covered with drinking water. We have about 60% of the schools covered with separate toilet for girls and boys, separate toilet for girls, and about 84% of the schools actually having at least one single toilet. There are issues of functionality which we will be dealing with later on, but this is the data which the National Environment Monitoring System, Education Monitoring System actually shares, and this is where we are as far as the status of WASH in schools is concerned. Pretty good coverage figures at the moment. But as far as hand washing, a key determinant of a good WASH in schools program is concerned, as far as we have about 88% of the schools without soap or any other detergent for hand washing by children. Just about, this is a study that UNICEF had done in 2010, just about 12% of schools actually had some detergent or some means to wash hands, a very low figure. So in summary, what is it that we have? We have in India an issue of scale. We have about 110 million children enrolled in 1.4 million elementary schools of India. So this is a huge, massive number that we need to reach, and at a very rapid pace. And And therefore, any small reduction in the numbers and functionality actually means a lot in terms of actual number of schools. We have about, despite the fact that we have 93% of schools covered with drinking water, we still have 6.5 million children, which is about 3.46% of the children enrolled who do not have access to water. And despite the fact that we have 84% sanitation coverage in schools, we still have about 28 million children without access to toilets. That is about 14.7% of the total children enrolled. So these are the numbers that we are grappling with at the national and at the state level in India. However, we do have some key government commitments, and there is a very favorable administrative space in India to work on WASH in schools. First of all, we have the right to education. This is a constitutional right, and which guarantees compulsory education up till the age of 18 years to both girls and boys, and government is making all efforts to ensure that children are enrolled in age-appropriate classes. And right to education does guarantee, for the first time, WASH has figured in right to education, and it guarantees separate toilets for girls and boys and safe and adequate drinking water in schools. And what's more important is it sets a deadline of 3 years, that is 2030, for states to comply with the RTE guidelines and norms. Supplementing this, in 2012 we had a Supreme Court order which says it is imperative that all schools must provide toilets. Empirical researchers have indicated that wherever toilet facilities are not provided in the schools, parents do not send their children, and especially girls, to school. Now, this is very important landmark judgment that Supreme Court has passed, and all states are now hastening the process of construction of toilets. And there are issues related to it, but we can discuss that. And then the approach paper of the 13th five-year plan also says that by 2013 March, all the targets for school WASH will be completed, and in order to supplement that, we have a national sanitation campaign, which again sets a deadline for 2013. So you see, there are multiple policy and programmatic guidelines which are in place in India at the national and at the state level to support a good WASH in schools program. So we are making use of this administrative space and trying to influence, work on policies and programs and practices surrounding that. Which are the ministries which are involved in India? We have, first of all, the Ministry of Drinking Water and Sanitation, which provides the funds for WASH infrastructure. We have 3 ministries working for WASH in schools, if you see. The Ministry of Drinking Water and Sanitation, it provides the funds for WASH infrastructure. It provides for individual school toilets for girls and boys. There are standards and norms, and there are unit costs which have been earmarked. Every year there is a planning process where the states apply to the center for funds for the number of school toilets that they want to construct. They also do a monitoring. They manage the National Monitoring Information System, MIS, which is essentially a record of progress against the annual targets set by the ministry. Then they also have the budgets for IEC and hygiene promotion. The Ministry of Human Resource Development, under which there is the Department of Education, which implements the RTE. It provides for teacher education systems. It provides for training and capacity building of teachers. So we make use of this forum for the hygiene promotion programs within schools. Then they also manage the EMIS, which is essentially a monitoring system for the 1.4 million schools where the data is aggregated at the national level and analysis done. The Ministry of Health runs the school health program, again in all the states. Now coming to the key challenges, now these are the data at the national level, but we will be talking about how states differ. At the national level, you see one of the key issues is the issue of functionality. The left graph is the data of 2010. So you could see how, despite the fact that 93% of schools are covered with drinking water. It's just about 76% functional, and 80% schools are covered with toilets, with just about 61% functional of those 80%. This is the national EMIS data. When you come to this the second graph, which is the ACER, which is again an independent, which is essentially an independent monitoring system, which is run by a civil society organization, but a very leading one. ACER stands for Annual Status of Education Report. Now they also do the WASH analysis, and you could see that just about 51% of the school, in just about 51% of the schools, they have found the toilets to be functional. So what does it say? It says that only 1 in 2 toilets are actually functional. So the investments are lost, the resources are lost, and so is the time. Coming to another key challenge, and that is the disparity in the coverage. And even the national picture actually covers some of the key issues which are in the state. You see 7 states of Odisha, Meghalaya, Chhattisgarh, Jharkhand, Assam and Bihar, they constitute almost 50% of the children without access to toilets. Now these are the areas where our efforts and our energies are most focused. These are again some of the focus states of UNICEF, and we are trying to address the gaps in these states. So there is a huge disparity. You can see a few greens and a few yellows and a few reds, and reds are all concentrated across central India and East India, Northeast India. Coming to the data inconsistencies, another major challenge is the fact that we don't have, our data is not aligned. There are 3 major monitoring sources for WASH in schools. I mentioned about DICE, which is the National EMIS. I also mentioned about ACER, which is a civil society independent monitoring survey. And we have the EMI, the monitoring information system of the Ministry of Drinking Water, which provides funds. There are disparities and there are huge differences when you see, especially when you look at the functionality figures. 75% is the amount quoted by, is a figure quoted by DICE, which is the national system, and 37% is what quoted by ACER, and you can see the other differences. Now this actually leads us to a huge issue of how do we strengthen and how do we streamline these monitoring systems. Again, another area where UNICEF is focusing its energies on. Coming to another challenge is of the toilet pupil ratio. As you can see, there are states with good figures of 41 and 57. These are the relatively smaller states, but when you talk of large states like Bihar, West Bengal, now these are, you can see the ratio, 1 toilet is used by about 243 children. So in states like Bihar, West Bengal, Maharashtra, 1 toilet is used by more than 100 students. Now this is a major, again, a major issue. Now what we have done is we have used the Tanahashi model which is actually being used has been used in the health sector. It was first used in the health sector to develop coverage models for evaluation of health services. This is actually an analytical method which identifies systemic constraints which are affecting health systems from achieving the desired coverage levels. What we have done is we have adapted it and tweaked it for WINS. There are, as you can see, a few core determinants that explains the capacity of the WINS program. And these are covered under 4 major categories of enabling environment, supply, demand, and quality. So now what are the key determinants that we have used to do the analysis of the WASH program in totality? For enabling environment, the key determinants we have used are the social norms, whether there is a social norm on hand washing, whether there are legislations and policies related to washing schools, whether there are budgets available for hand washing facilities, for infrastructure, whether these are being spent, which are the partnerships which are working, is there a good governance mechanisms. As far as supply is concerned, we have looked into issues of availability of essential commodities. What are the inputs? Are they on time? Is there soap available? Whether there is, water supply? Whether there are, there are systems to manage these. what is the access to adequately staffed services and information? Is there an MIS system in place? Whether washing schools is being monitored, whether there are trained teachers. And on the demand side, we have looked at the financial access, social cultural acceptability, continuity of use, and in quality, we have looked at the quality of the wash services. Now, for each of these, we have identified few core indicators. I just want to share that. As far as social norms is concerned, we have used the indicator whether all children are expected, from a social norm perspective, whether all children are expected to practice hand washing with soap at critical times by the head teacher, and whether the same is expected by the community and and also by the children. Whether there's a legal framework, whether there's a national legislation on washing schools, whether there are standards, whether there are monitoring systems in place. As far as policy framework is concerned, we have looked at sector policy, whether it reflects washing schools. Now, for each of these, there are different methodologies of coming at a particular percentage. I'm not going into details of that. Some of these, especially the enabling environment, where we are dealing, it's mostly interviews and review of existing literature and policies. In supply, it's a survey, and the survey data. At the demand and the quality level, we look at actual school level monitoring. We have looked at budgets and expenditure, for which we have taken the indicator of what is availability of multi-sectoral budget for washing schools. Are there capital and recurrent costs available for operation and maintenance? At the supply side, we have tried to see what are the functionality figures, whether they comply to national standards. At the level of, for availability of human resources, we have looked at trained teachers on hygiene promotion and access to services. We have looked at whether hygiene education is taking place on a daily basis. So these are some of the indicators that we have used for different determinants. Now, this is the result that we have arrived at. You could see we have just about 2 green, which there is an enabling environment, definitely. There is a constitutional mandate, there are programs, and there are frameworks in place in India. But the key critical gaps are in the area of, you can see the red ones, data availability, the percentage of schools with sustained supply of soaps, the operation maintenance budget and dedicated funds for O&M of wash facilities, the systems, the processes. I think there's a major gap there, and in the last one, in terms of hand washing behaviors amongst children. So what we are essentially trying to see is where are the critical gaps in washing schools, and where is it that we need to work more aggressively and to have a minimum level of system efficiency. Now, this is what we have looked at. You can see at the base minimum, the system efficiency is at 10%, and we need to cover the gaps and bring it to at least a moderate level of efficiency in the short run, which we think is at least, the ones which are least, we can come up to that level and we achieve the minimum system efficiency at that level. What we are trying to say in the process is, once you do the bottleneck analysis, you get to know where we need to put our energy and we need to put our focus on, and where we need to prioritize our time. The larger the gap, the more is the time necessary, essential to cover that gap to be able to attain an optimum efficiency in the system. So here in this case, you could see, that we've identified 3 major areas where we need to work on, and I'll subsequently share with you what exactly we have done in that, how we have, what kind of policies that we have tried to influence, or systems we have tried to put in place in partnership with the government. So what is it that we have used as advocacy tools? Quickly, we have we do make use of these. These are commonly used advocacy tools. Nothing different from what maybe others are using. We have regular consultations and meetings with the government. We We do data analysis, we bring in evidence, we prepare snapshots to track progress, we bring in hard data to the table. We make government to believe that, well, some of the systems are not, not tracking the progress in real sense. So we have concurrent monitoring in place. We prepare policy briefs, we engage with elected representatives, and we prepare advocacy toolkits as well. So all this collectively we have used to work closely with the government. In summary, what has been the key results in policies and practice? So there are 4 major areas that we have worked over the last few years: operation and maintenance of school wash systems, monitoring and evaluation, defining and developing wash standards, and hygiene and hand washing. On hygiene and hand washing, if I tell you that the school health program now includes hand washing, hygiene education, and use of toilets in schools. Till about a couple of years ago, the school health program was just about deworming and only about monitoring of children for the 3 Ds: disease, deficiency, and disability. Now the revised school health implementation template includes very strongly hand washing. It talks about institutionalizing hand washing in all schools. It talks about hygiene education apart from education in nutrition, and provision of separate toilets and use of these toilets in schools. In a major move, we have also been able to get government issue, the Ministry of Human Resource Development issue a circular to all states in the country institutionalizing hand washing in all schools. That means that it has the potential to reach 110 million children in about 1.4 million schools. And of course, there are subsequent state follow-up circulars which have been issued. So all efforts are there to, put that in place. We have worked on standardizing designs and manuals, which are now mainstreamed in all the states. Till recently, most of the states had one single standard unit cost and design. Now these have been changed, and we have standardized the designs, and we have got the unit cost increased, and now these are being run in the states. Importantly, WASH norms are now included under the Right to Education framework. So we have the WASH norms as to how many children can use one hand pump or one hand wash points for hand washing, and so on and so forth. On M&E, we have done a major work in terms of analysis of the 3 data sources. We have identified the key issues in monitoring, and what is important is there is an acceptance of the data gaps by Government of India and willingness to relook at the definitions. We have, for this year, we have got functionality and included with better definitions, hand washing facilities which will be recorded, and gender disaggregated toilet to be included. On operation and maintenance, we have got interministerial dialogue started for dedicated allocation of O&M. Now this is important because both the ministries, both Ministry of Drinking Water and Sanitation and Ministry of Education now are working at much more increased allocation for O&M based on the discussions, what we have had. And some of the states have also been able to generate O&M funds under the school maintenance grant, which was so far not being used for WASH. Finally, so what we will now work at the next level would be, we will work towards standardization of approaches and scaling up of hand washing with soap in all schools. We are trying to slowly make the shift towards education, and try and get Ministry of Human Resource Development along with Department of Education to work closely and get more involved and take the responsibility for WINS through budgets and systems and processes and so on. We'll be working towards setting up higher standards for WINS in country, support the scaling up of quality services. We are also looking at how we can develop a framework for benchmarking of schools, a kind of a rating system which can work for all the schools in the country. I mean, this is huge challenge, but definitely we are working towards developing a framework and standardized template for this along with the ministry. And we will very closely look at strengthening institutions to undertake all of the above. Thank you.
Thank you, Mamita, for this presentation. I think we have 5 minutes left before the end of the webinar. So I would like to suggest to only take one question and ask you to briefly respond to it. If we need more time, we can prepare a more elaborate question and put that into the reporting, which we will also do with the questions we cannot answer right now. So the last question that came in was about how did you came up with the list of indicators? For example, was there a national WASH task group, or how did that go? Could you briefly answer this?
Yeah. The list of indicators you see are kind of standard, which is the Tanahashi model. For example, if you're talking of, let's say, policy, strategy, and framework, which is a key determinant, so the indicator would be the government or whether the government or the education sector, WASH sector has policies on washing schools, it has budgets allocated, it has budgets for hand washing and hygiene. Or if you look at another indicator, for example, availability of essential commodities, you look at what percentage of schools have access to functional drinking water facilities, what percentage of schools have access to functional toilet facilities, and so on. So these are kind of standard indicators that are available as a part, that do exist as a part of the Tanahashi model. Hello?
I think we may have lost our moderator.
Sorry.
Not very good. But that actually is the end of the webinar today. So I'd like to just step in. This is Malaika once again, and thank everybody for joining. I hope that you gained something from these presentations. As Ingeborg had mentioned, we will go ahead and do a report and post the recording on the IRC website, and I believe we will try and answer some of the unanswered questions. So we will definitely keep you all posted and send out further information. So thanks everybody once again, and we hope to be in touch soon.